ये पी। हाँ अरे आई एम विजिबल यार. All scores are good scores. I don't believe in numbers. Paper was very tough. That was the whole purpose. Paper is tough. That was the whole purpose. Otherwise, how will we learn? है ना? Learning is a lifelong process. Just keep learning. Okay, just keep learning. Yes, we should keep studying. Ah, so see, है ना? That was the whole purpose, बेटा जी. That was the whole purpose. करें शुरू करें चलें. नहीं यार सुनो लिसन मिशेल एंड एवरीवन हु इज फीलिंग लिटिल डाउन. ठीक है. whenever I face a difficult situation, ठीक है, I motivate myself by telling myself that next time I'll do better. ठीक है. This happens with us every time. ठीक है. And I'll share a personal scenario. I was operating on my mother's my best friend's mother. ठीक है. On my best friend's mother. ठीक है. He is my childhood friend, and I was operating. Surgery went absolutely fine. Absolutely cakewalk, very smooth surgery. Okay. While injecting the lens, this is after cataract surgery. While injecting the lens, okay, the lens broke. The lens broke inside the eye. Yes, this is. I'm not making this up. Even when I'm telling you, I'm getting goosebumps. The lens broke. ठीक है. अरे यार ये क्या हुआ? शेयर स्क्रीन चला गया. So lens broke. विकास कुछ तो कर दिया यार.
एक मिनट रुक जा भाई.
Then I had to convert it into a ECCE. I had to make a full incision, explant the broken lens, put a new lens, and I had to put sutures. Whereas I had done a absolutely good surgery. At some point, while loading the lens, an error had happened. So this is something which I learned that day. That first, move the lens forward, backward, and see it is freely moving. It was a very good quality lens. There are no reports of it ever getting stuck, but somehow it happened. So you learn. नहीं, you cannot sue the manufacturer. ऐसे ही हर चीज के लिए don't think about suing somebody. ठीक है. मिनिमम स्कोर बता दो प्लीज. मिनिमम स्कोर इज 2. क्या करोगे मिनिमम स्कोर का यार? हाँ, फिर वही बात ले दे के स्कोर. What does the score matter बेटा? ठीक है. Think today. ठीक है. Make sure that you have learned something today. विकास भाई ये क्या हो गया आज फिर से? चलो स्टार्ट करें. लेट अस स्टार्ट. ठीक है. It's time to go. Nothing. You did not miss anything, Akansha. We are starting with this. Okay. Chalo. Let us start. So this is the first question. No prior refractive undergoes LASIK surgery. Twin underwent a phakic intraocular lens implantation. What is the correct? Which of the following is correct scenario? Yes. Okay. It is B. Myopic is corrected. So LASIK was performed and refractive index. So hyperopic shift occurs in scenario A. From myope, you are bringing the patient towards emetrope. So there is going to be a hyperopic shift. Day 2 की PDF नहीं मिली अभी तक. Okay, Shivam, I will raise this. I believe my team is looking into this. विकास जी, Day 2 की PDF नहीं मिली. ठीक है, चलो, ठीक है. So in scenario A, there is a hyperopic shift. In scenario B, there is an increased effective lens power because you have put a phakic IOL. Okay, so what is phakic IOL? Phakic IOL is same as a ICL. Phakic IOL. Today, whatever topics we are going to do are ones which we have not covered yesterday. So in these questions, you will find some topics which are advanced level. Okay, so phakic IOL, also called as ICL. Okay, implantable contact lens. Okay, this is where it is called as phakic IOL because you are putting it this IOL intraocular lens. You are putting over the normal crystalline lens. Okay, one important point. Second important point, what is the minimum MCQ? What is the minimum anterior chamber depth required for ICL surgery? What is the minimum anterior chamber depth required for ICL surgery? It is, yes, 2.8 millimeters. Okay. So these are all PYQs, beta. These are all questions which can be asked. Okay, so let us focus here. So 2.8 millimeters is ICL for ICL surgery. What all measurement is required? So one is anterior chamber depth. One is anterior chamber depth. Another very important measurement that is required for ICL surgery is white to white. White to white, that is limbus to limbus. Limbus to limbus measurement horizontally. Horizontally measurement. These are the two measurements which are very important for determining the ICL. For determining the ICL. No, but not lens thickness. These are the two measurements, anterior chamber depth and this. Okay, correct. Very good. Next, question number 2. OCT confirms macular edema. What's the following are modified Arley House criteria? Clinically significant macular edema, CSME. CSME. Okay, CSME. Yellow. What is CSME? CSME is clinically significant macular edema. Okay, correct. So remember, in case of diabetic retinopathy, in case of diabetic retinopathy, we are done yesterday. You classify as NPDR, you classify as PDR, and the third thing that is required, that is there in diabetic retinopathy, is CSME, which is clinically significant macular edema. This can occur in NPDR also. This can occur in PDR also. This can occur in NPDR also. This can occur in PDR also. CSME was given by Arley House classification. What does it say? Remember yesterday I told you there is a foveal avascular zone. Remember yesterday I mentioned a foveal avascular zone. How much is the size? It is 500 microns. It is 500 microns. Okay. So first is there three criteria. First is any edema in this central 500 micron avascular zone. One is this. Second is any exudate with edema, okay, with associated edema in this central 500 micron avascular zone, okay. And third is any edema outside, okay, any edema which is outside this 500 microns, but this is more than one disc diameter size. It is such a big. How much is one disc diameter? Remember, how much is one disc diameter? How much is one disc diameter in microns? How much is one disc diameter in microns? Come on, come on, come on. No, not 3.5. No, not 2.5. No, not 50. 1.5. 1500. 1.5 millimeters or 1500 microns. Yes. 1500 microns. Any edema which is so big, 1500 microns big edema, part of which is coming in one disc diameter of foveal avascular zone. ठीक है? Part of which is coming in one disc diameter of foveal avascular zone. This third, देखो, edema. So CSME, clinically sickly macular edema. Please focus on this word edema. ठीक है? Why do you have classified? This is question number 2, beta. Question number 2. So any edema which is there in the center, ठीक है? That is there. Any edema with exudate in the center, that is also clinically significant. Any edema which is outside but big and is threatening the foveal avascular zone. Okay, is threatening the foveal avascular zone. This is what is called as CSME. So the correct answer here is retinal thickening, microaneurysm is not there. Retinal thickening, C. Answer is C. Answer is C. Okay, correct. Is this okay? Have you understood this? Okay, correct. Okay, moving on next question. But a microaneurysm is not edema. Microaneurysm is just bulging. Microaneurysm is just bulging. Okay, why not D? Cotton wool spot is again no edema. Cotton wool spot is ischemia, beta. Cotton wool spot denotes ischemia. Retinal thickening implies edema. Yes, retinal thickening is edema. Retinal thickening is edema. Why would otherwise thickening happen? Any exudate, beta, any exudate with edema. See, exudate with edema. Exudate has to be with edema. And it is the macular area. Macular area is not there. It has to be 500 micron. It has to be 500 micron. Is this okay? Is this okay? Yes, it was a tough question. Yes, this was a tough question. ठीक है? चलो, next. 3-year-old child has upward deviation, covered as hypertropia, forced duction test is positive. Remember, forced duction test, FDT, is for restrictive squint. Okay, here the restrictive squint is Brown syndrome. Brown syndrome. Okay, what is Brown syndrome? It is superior oblique tendon shortening. Superior oblique tendon shortening. Okay, this is Brown syndrome. The superior oblique tendon is not there. But a Duane retraction syndrome. Okay, yes, Duane retraction syndrome can be there, but there is no hypertropia there, na? There is no hypertropia. Okay, it is not a vertical. It is not a vertical squint. Not a vertical squint. Okay, what is the sine qua non? What was the sine qua non of this? What was the sine qua non of this? That is retraction of the globe. Yes. In mein in, out mein out. Okay. That was the hallmark. It is not mentioned here. Correct. So Brown syndrome is the correct answer. Yes, there is difficulty in. There is difficulty in. There is going to be a vertical squint, beta. There is going to be a vertical squint. Vertical squint. Superior oblique tendon. Superior oblique is. अरे यार ये आज क्या हो रहा है? Why this? Superior oblique. Yes. Superior oblique is a depressor. So if it is tight, the elevation will not be there. There will be a vertical squint. There will be a vertical squint. Correct. Understood. ठीक है. देखो बेटे बाकी क्वेश्चन बाकी आंसर्स नहीं बनेंगे. बाकी आंसर्स नहीं बनेंगे. ठीक है. Types of Duane are 3 types of Duane बेटा. Duane retraction syndrome. Duane retraction syndrome is of 3 types. Type 1, type 2, and type 3. Okay. Type 1, abduction limited. Abduction is not there. Okay. Type 2, adduction is not there. And type 3, both abduction and adduction are affected, are not there. So both are not there. Okay. Correct. Understood. हाँ बेटा ठीक है. You are right. Dr. Dermadoc, everybody, yes, this is correct. That there will be a defective in Brown syndrome. In Brown syndrome, if this is the eye, if this is the eye, if this is the eye, okay. In an abducted eye, elevation depression is by the superior rectus and inferior rectus. In an adducted eye, the elevation depression is by the inferior oblique and the superior oblique. So if the superior oblique is shortened, if it is tight, okay, there will be a defective elevation. There will be a defective elevation. The other eye will get compensatory elevated. Okay, the other eye will get compensatory elevated. In an attempt to bring this up, this will go up. Okay, in an attempt to bring this up, this will go up. So there will be a vertical squint only, beta. Only in Brown syndrome there will be a vertical squint. Yeah, Raj, something is a problem. फिर से चला गया. Is my screen visible? नहीं ना. कल इंटरनेट में इशू था. आज इसमें चलो ठीक है. Okay. So in all others, please see, in all other choices, it is not possible. In all other choices, it is not possible, beta. ठीक है. Correct है. चले आगे. देखा Dr. Strain Supreme, beta, this is working. See, you are right. This is working well, but this tendon is tight. It will not allow the eye to go up. It will not. This is why the FDT is positive. FDT is positive. It is not allowing the eye to go up. When the eye has to go up, this has to relax. This has to relax. Only when this will relax, the eye will go up. That is the whole reason for FDT positive. दैट इज द होल रीजन फॉर एफडीटी पॉजिटिव. ठीक है. नहीं बेटा, एफडीटी आई टोल्ड यू yesterday also, एफडीटी is positive, एफडीटी is positive in all restrictive squint, in all restrictive squint. One example of restrictive squint is DRS, Duane attraction syndrome. The other example is Brown syndrome. The other example is thyroid eye disease. Thyroid eye disease. Okay. The other example is thyroid eye disease. Okay. Correct. Understood. चलो next आगे चलते हैं यार. Yes, so we relax, we release. Yes, superior oblique tendon release is the treatment. Superior oblique release is the treatment. Okay, correct. Let us move to next question. It will be hypertropia. Yes, it will be hypertropia. Presents with decreased vision due to bullous keratopathy. ठीक है. Which corneal transplant technique is most appropriate to restore vision now surgical vision? It is yes. It is C. It is C. Very good. Okay. So if we talk about corneal transplant, it can be a full thickness. It can be a full thickness or it can be a partial thickness. It can be a full thickness or it can be a partial thickness. Full thickness is called as penetrating keratoplasty. Penetrating keratoplasty. PK neat. Where is PK neat today? Okay. Partial thickness is called as lamellar keratoplasty. Lamellar keratoplasty. Okay. Lamellar keratoplasty can be of two types, can be anterior or can be endothelial. Can be anterior or can be endothelial. Anterior is DALK and endothelial is DSAEK. ठीक है. One is DMEK also. Okay, one is DMEK also. It is DM. ठीक है बेटा. A इसलिए नहीं क्योंकि it is anterior. Here there is bullous keratopathy. Why do you get bullous keratopathy? Why do you get bullous keratopathy? It is because of endothelial cell loss. Endothelial cell loss. ठीक है. It is because of endothelial cell loss. Okay, Dr. Shishti Dubey. ठीक है. Correct. Next. Moving on to next question. ठीक है. Role of magnocellular. Where is magnocellular? Yesterday you guys were telling LGB has how many layers? LGB has how many layers? 6 layers. LGB has how many layers? 6 layers. ठीक है. Out of these 6, 1 and 2, these are magnocellular. ठीक है. 4 to 6, these are parvocellular. ठीक है. 1 and 2 are magnocellular, 4 and 6 are parvocellular. Yes, you are right. 1, 4, 6. They receive contra input, contralateral. 2, 3, 5. They receive ipsilateral. ठीक है. 2, 3, 5. Ipsilateral. I'll show. Okay. M for magno, M for motion. M for magno, M for motion. Parvo is for detail. Detail, color, okay. Detail, color, visual acuity. ठीक है. These are for parvo. ठीक है. Parvo is for this. So the correct answer is motion detection and 146 is contralateral. So this is the correct answer. Okay, correct. Dr. Michelle. ठीक है. So this is what is the correct answer. चले आगे. Is this okay? Magnocellular parcel. LGB, latest electrode body. So next. Next. Spherical equivalent. What is spherical equivalent? Beta, read this line. Read this line. Minimum surgical trauma. Dr. MSD. Okay. Minimal surgical trauma. If you can change only one layer, why do you want to change the entire thing? Okay. Why do you want to increase the risk of rejection? Why do you want to put sutures? Okay. They are going to do so many suturing. Okay. Correct? Understood? Now, let us do this. What is spherical equivalent? What is spherical equivalent? Spherical equivalent is spherical equivalent is the spherical value plus half of the cylindrical value. Half of cylindrical value. Half of cylindrical value. So -2 and half of this, the correct answer is this. -2, half of this is correct. Why, sir? But this is used in patients who are used in patients who are unable to tolerate cylindrical powers. Cylindrical powers. Good evening, Dr. Swara Misha. Good evening. See, this is how I explain to my patients also. What is a sphere? Sphere is round like this. No matter how you turn, it is going to be circle. Okay? Focus on my eye. Okay? It is a sphere. So even if it is a little decentered, it will not affect. Okay? Even if it is a little decentered, it will not affect because it's a sphere. Cylindrical value is like this. If you have placed it, it is 90 degree. If your place is 135 degree, place it like this, 0, 0, 180 degree. Place it like this, 45 degree. Okay, where you are placing it is there. If the cylindrical value is decentered, it will cause lot of effect. Understood? Have you understood? Okay. Now, if some patient is having cylindrical value and the patient looks on one side, then the cylindrical value is not working. Okay. So the patient has to turn the head. Some patients, like myself, I am not able to tolerate cylindrical value. It is very difficult. It gives me, okay. So this is why cylindrical value, some patients require spherical equivalent. Okay. Yes, we can make contact lenses with this also. Okay. Correct. Okay. Those are called as toric lenses. Next, question number 7. Next, question number 7. There is a pupil does not constrict to light, but constrict on accommodation. ARP, PRA. Where is the damage? Treponema pallidum. Okay, it is neurosyphilis. It is damage to the. Okay. Okay. Dr. Jasmine will discuss this later, बेटा. 90 degree भी देगा तब भी ऐसी होगा. ठीक है. Neurosyphilis, damage to predator area. Correct है. Understood. Very simple. This was very, very simple. ठीक है. What is this? On rightward gaze, left eye fails to adduct, while right eye abducts with nystagmus. Left eye fails to adduct. ठीक है. Where is this? Which of the following deficiency contained from the third nerve palsy? Third nerve palsy. This is, yes, it is lesion in the MLF It is internuclear ophthalmoplegia. So what is differentiating INO from the third nerve palsy? From the third nerve palsy, the answer is nystagmus in the abducting eye. Nystagmus in the abducting eye. ठीक है, nystagmus in the abducted eye. This is there. यार आज क्यों हो रहा है ये? Why is this happening? Okay, not coming. Not coming. Is this okay now? Correct. Okay. सब ठीक है यार, मेरे यहाँ से सिग्नल जा रहा है. आई एम नॉट एबल टू सी द स्क्रीन. आर यू गाइस एबल टू सी द स्क्रीन? You are not missing the screen. But I don't know why I am missing. My screen gets conked off. Chalo, all good there, पता नहीं. So today I'm not able to. अरे but अच्छा ठीक है. But how do I know which question is coming? But I don't. ना चलो ठीक है. Is this okay? This is there. Next question. Okay. Stable refractive error -7. ठीक है. She has SLE. Currently managed hydroxychloroquine. Thickness is 520. Strongest contraindication to LASIK. This is okay. Thickness is okay. This is okay. Autoimmune disease. This is the correct answer. Okay. Autoimmune disease, beta. Hydroxychloroquine is not a contraindication. Hydroxychloroquine is not an contraindication. ठीक है. Hydroxychloroquine, beta, because SLE, remember yesterday, diseases, I told you na, diseases with systemic contraindication. Okay, so that is why diseases with a systemic contraindication, I told you yesterday also, beta. ठीक है. Ocular echo, diseases with systemic contraindication. ठीक है. No echo, it's fine. भाई आज बस कर दो यार, मत डराओ यार. I am a person with weak heart. ठीक है. I don't have a strong heart. चलो आगे. ठीक है. I told you yesterday also यार. चलो ठीक है. Against using ICC, which of the following is most strongly support the decision? It is the Wiegard's ligament. Remember, it is the Wiegard's ligament. Yes. What is Wiegard's ligament? What is Wiegard's limit? Limit of column thickness. Beta, 4 less than 470. Less than 470 microns. No laser procedure. No laser procedure. ठीक है. Less than 450 is an absolute contraindication. ठीक है. Less than 470. Okay. Correct. चले आगे. Now, question number 10. Wiegard's ligament. What is Wiegard's ligament? What is Wiegard's ligament? What is the other name of Wiegard's ligament? It is not a thickening. It's a ligament between the hyaloideo capsular ligament. Hyaloideo capsular ligament. Hyaloideo is vitreous. Capsular is capsule. It is the attachment between this. No, zonule fibers are absolutely goodly developed in children. Zonule fibers are absolutely good developed. Dr. Akash Soni, it is absolutely good developed in children, beta. No issues with that. Okay. Nuclear sclerosis. Nuclear sclerosis. Which is the correct answer? Yes, this is very, very simple. It is C. 66% water, 30% protein, relies mainly on anaerobic metabolism. This was very, very simple. Okay, this was very, very simple. Okay, is this correct? Next, uncommon cataract, gradual after 6 months, clusters behind the eye well. What are these? What are these? Arsenic pearls. What is the treatment? Treatment is anti-YAG laser capsulotomy. Anti-YAG laser capsulotomy. Okay, correct. Next, window defects in the Brooks membrane. Window defects in the Brooks membrane. What are these window defects? What are these window defects? What are these called as? Lacquer cracks. Lacquer cracks. Okay. And also called as angioid streaks. Also called as angioid streaks. Lacquer cracks or angioid streaks. What are the diseases which can lead to this? What are the diseases which can lead to this? The mnemonic that I normally give is Pepsi. Pepsi. Paget's. Paget's. Ehlers-Danlos. Ehlers-Danlos. Pseudoxanthoma elasticum. Pseudoxanthoma elasticum. Okay. Sickle cell disease. Sickle cell disease and idiopathic. And idiopathic, which is basically myopia. High myopia. Basically high myopia. Okay. This is what. So the correct answer is Pseudoxanthoma elasticum. Okay. Correct. Next. This we have done yesterday. History of LASIK. History of LASIK. Yes, it was Haig's L. Haig's L. Okay, Haig's L. Hoffer Q. Hoffer Q for small eye. What was for long eye? What was for long eye? It was holiday. Holiday. Even SRK-T can also be used for long eyes. SRK-T can be used for both normal and long eyes, please. SRK-T can be used for both normal and long eyes also. Okay, correct. Very good. Okay. What does Haig's L basically take into consideration? It takes into consideration the flat keratometry. MCQ. It takes into consideration the flat keratometry. Okay, beta. ठीक है. In LASIK, post LASIK. ठीक है. Correct. So, 6-year-old child is found to have left hypertropia. On head tilt test, hypertropia worsens on left tilt. Worsens on left tilt. Worsens on left tilt. Yes. So on ipsilateral side, it worsens. So basically, left superior oblique. And on ipsilateral side, it worsens. So this is left superior oblique. Correct? Okay. Is this okay? Next. Next. EDOF lenses. Extended depth of focus lenses. Excellent. Excellent distance vision. Okay. But he does not have. He is disappointed with freedom from glasses. What explains? EDOF lens, accommodative lens power is not restored. Question number 15. Are Bilshowski head tilt, yaar, we had done yesterday, beta. Bilshowski head tilt, we had done yesterday, na beta. ये देखो, ये तो रहा. Bilshowski head tilt we had done yesterday. हाँ यहाँ पे so here Bilshowski head tilt we had done yesterday. हाँ बताऊंगा डॉक्टर फैसल हसन खान, बिल्कुल बताऊंगा. ठीक है. सी हेयर patient is presenting with, here they have said in this question, in this scenario there is right palsy, right hypertropia, patient tilts to head to the same side. ठीक है. There is worsening. There is worsening. Okay. So composite. So head tilt to the opposite side. There is good. Okay. So in this question, see here, left hypertropia, left tilt worsens. Okay. So if you see here, so same side, it is worsening. So if you just put here left, patient is getting left hypertropia and on left side. So same side, the superior oblique is not working. Okay, correct. Is this understood now? Okay, so left superior oblique is the correct answer. Left side superior oblique is the correct answer. Okay, correct. Next, accommodating amplitude is not restored. This is correct. EDOF lenses, there can be toric lenses. There can be toric EDOF lenses, which can be there. PCO IL decentration, they will not give 6/6 vision. Okay. This will also not have 6/6 vision. This will also not have 6/6 vision. So the correct answer is A. Correct? Understood? Basically, the patient was not counseled properly, was not explained properly. That is why he is disappointed. You need to tell the patients with EDOF lenses that distance vision will be good, but for near vision, for absolute near vision, they would require reading glasses. Okay, they would require reading glasses. Correct. Next, 50-year-old CD ratio of 0.65, 0.35. So a difference of more than 0.2 between two eyes is significant. Please remember. Okay. So what do? You have to do the glaucoma test, visual field test, and optic nerve imaging. You have to do. Okay. Correct. Even though the IOP is normal, you will have to do the visual field test and optic nerve imaging, and you'll have to follow the patient. ठीक है. डॉक्टर मीटियोर राइट इंफीरियर ओब्लिक कैसे हो सकती है बेटे? राइट इंफीरियर ओब्लिक नहीं हो सकती बेटा. ठीक है डॉक्टर मीटियोर. ठीक है. सेम साइड हेड टिल्ट होगा ना बेटा, तो लेफ्ट साइड का लेफ्ट साइड सुपीरियर ओब्लिक होगा. ओके. लिमिटेशन ऑफ abduction in the right eye, diplopia. On forced suction test, passive movement is restricted. Again restricted. See here, in this question, ना बेटा पैसिव मूवमेंट इज रिस्ट्रिक्टेड. ठीक है. एफडीटी में नहीं हो रहा. ठीक है. इट इज ड्यूनेट ट्रैक्शन सिंड्रोम. ओके. इट इज अगेन ड्यूनेट. so FDT is positive. But in this question there is a horizontal squint. Beta. Yes, type 1 ड्यूनेट ट्रैक्शन type 1. Absolutely good. ड्यूनेट ट्रैक्शन syndrome type 1. ठीक है. करेक्ट है. नेक्स्ट, टू नेक्स्ट क्वेश्चन. ठीक है. evaluated under anesthesia, ठीक है, 2 month old child, ठीक है, which of the following is, बेटा इसमें क्या बताऊं, देखो अच्छा ओके, FDT positive, you know, this is in restrictive squint. Which one is restrictive? This is a paralytic squint. This is a paralytic squint. Brown syndrome is a vertical squint, beta. It will cause vertical squint. ठीक है? It is superior oblique tendon shortening. Superior oblique tendon shortening. I've told this in earlier question. It will result in vertical squint. ठीक है? Here it is a horizontal squint. See here, beta. Limitation of abduction. It is a horizontal squint. ठीक है? Orbital floor fracture will also result in a vertical squint, beta. ठीक है? यहाँ पर it is only horizontal squint. Correct? So this is divine attraction syndrome. Okay, correct है, understood है मेरे बच्चों. चलो next, ठीक है, tonometer is appropriate. Which of the following is appropriate? Which of the following is appropriate, beta? Yes. So the correct answer is B. That is Perkins handheld tonometer. Perkins handheld tonometer. Okay, Perkins handheld tonometer. Correct है. Okay. Next question. Orbital decompression is considered in thyroid disease for cases of proptosis. This is correct. So A is true. So this is out. Okay. Orbital decompression immediately improves angular strabismus as well as diplopia. No, that is not there. Both are not true. R is false. So the correct answer is this. A is true. R is false. 53 is good, beta. 53 is definitely good. Dr. P can eat. 53 is definitely good. चलो ठीक है, A is true, R is false. ठीक है, गोल्डमैन में कोई एज तो नहीं है, नहीं गोल्डमैन में कोई एज नहीं है, बट गोल्डमैन इज बेसिकली a slit lamp. This is slit lamp mount. This is slit lamp mount. You cannot make a 2-month-old on slit lamp. Better because applanation is a better one than a indentation. ठीक है, applanation is always better than indentation. ठीक है, okay. Why not D? How will you make a child sit on this? This is non-contact tonometer. This is a non-contact tonometer where the air puff goes and hits the eye. How will you make the child eye look into the screen? Okay, you cannot make. Sir, Perky is not good for you. हाँ तो मेगा कॉर्निया है, होगा तो इवन ही, इट इज इवन बेटा. ठीक है, इट इज इवन ओनली बेटा, इट इज नॉट इवन, इट इज अ मेगालोकॉर्निया. ठीक है, बेस्ट वुड बी टोनोपेन, बट आउट ऑफ द चॉइसेस गिवन द बेस्ट इज देयर. ओके, करेक्ट बेटा, बाय स्क्विंट सर्जरी. ठीक है, द स्क्विंट इन थायराइड आई डिजीज कैन बी ऑफ एनी टाइप, but it is very difficult to control the amount of squint. Okay, so squint surgeries are not very good. Squint management in thyroid eye disease is not predictable. Okay, correct, because the muscle is all swollen up. So when you cut the muscle, when you tighten the muscle, how much muscle strength is there, you cannot titrate, you cannot measure. Okay, beta. So that is why squint assessment by surgery is very difficult. You manage the squint in case of thyroid disease by use of prisms. Okay, best is use prisms for management in thyroid eye disease squint. Okay, correct. ठीक है, understood. Next, gradual loss of vision. OCD shows RP thinning, RP atrophy, drusense, that is ARMD. What will you do? This is for wet ARMD. This is for wet ARMD. ठीक है, laser photocoagulation is not there. Antioxidants. Okay, it is a dry ARMD. ठीक है, this is a dry ARMD. ठीक है, okay. Next question. Ptosis, meiosis, and hydrosis. From congenital, it is heterochromia. It is heterochromia. It is heterochromia. ठीक है, Dr. Venkat, every number is good, beta. ठीक है, I always say, if you have scored 43, even if you have scored 1, 3, 13, that means at least you know 13 questions. Don't look at what you don't know. Look at that you know at least that much. Start working beyond it. Only ये देखो 43 वाले देख, डॉक्टर अनुकृति कह रही है ओनली 51, देख वो भी ओनली कह रही है। अब 51 वाले भी ओनली बोलेंगे तो क्या होगा? हैं, चलो वो देखो आ गया एक ओनली 52 वाला आ गया। अनुकृति, दिस इज फॉर यू, एलन मस्क हैज 52। ठीक है, चल आ जाओ नेक्स्ट। Immunocompromised vesicular lesions over the right forehead and nose without terminal bulbs. Higher risk of corneal involvement, which is there. It is Hutchinson sign. It is Hutchinson sign. वो देख 61 वाला भी आ गया ओनली। हे भगवान, वाला है कि वाली है मुझे नहीं पता, आई डोंट नो। 61 वाली पक्का वाली होगी, वाला होता तो नाम लेके बताता, आई एम वेरी श्योर। चलो ठीक है, गुड वन। चलो लेट अस गो अहेड। इज दिस ओके? दिस इज व्हाट हचिंसन साइन। ठीक है, सीन इन नेजोसिलरी नर्व, नेजोसिलरी नर्व, नेजोसिलरी नर्व। ओके, करेक्ट। Spread of rectoblastoma spreads by direct invasion. CSF spread is not the most common. Subacute spread can lead to brain. So it is the most common is via the direct invasion into the choroid and optic nerve. Via CSF spread is most common. CSF, but direct spread is the most common. Direct spread is the most common, beta. Incorrect. अच्छा, incorrect पूछा है। Sorry. Incorrect पूछा है। Okay, yes. अगर incorrect पूछा है बेटा, oh I am sorry. CSF spread is not the most common. Most common is direct invasion. Subrecurrent can lead to hemats. Lymphatics तो होते ही नहीं है. There are no lymphatics in the eyeball. ठीक है, there are no lymphatics. ठीक है, हाँ कोई बात नहीं, ये हमारे साथ भी होता है। मेरे नंबर काट लिए। डॉक्टर नारदीप सोनी ने हैज कट माय 1 नंबर, कि सर का भी 1 नंबर कट गया। ठीक है, हाँ उम्र हो गई है, देख करणवीर सिंह तुम्हारी हो गई होगी उम्र। आ जाओ नेक्स्ट क्वेश्चन। 34-year-old woman presents with recurrent episode of eye pain, epithelial changes, epithelial. Out of this which is epithelial? Out of this which is epithelial? ये तो endothelial है, तो this is out. Buccal lattice stromal होती है, this is out. Buccal और रह गए Cogan's microcystic dystrophy is the epithelial layer which is there. ठीक है, Breeze buccal, Rees Bowman's. Please remember this. ठीक है, Cogan's is also called as map dot dystrophy. It is another name of map dot dystrophy or fingerprint. It is the same. I told you this yesterday. Fingerprint, and the patient presents with foreign body sensation upon awakening. Foreign body sensation upon awakening. Okay, why is it so? Why? Because at night time When the patient is sleeping, the lid gets stuck to the epithelium. In the morning, when the patient wakes up with the lid, the epithelium comes off, causing pain. Okay, so this is how the patient with epithelial dystrophy presents early morning. Okay, how will the patient present with endothelial dystrophy? How will the patient present with endothelial dystrophy? Early morning blurring. Early morning, early morning blurring, which improves during the day. Improves during the day. Early morning blurring, yes, there is corneal edema. But when the eye is closed, the corneal edema is more. When the eye is open, because of exposure to the air, the edema subsides and the patient has better vision. So early Fuchs patient presents like this. Okay. Early Fuchs patient presents like this. Okay. Correct. Is this okay? Next. Okay. Which of the following is most accurate regarding the optical correction? Regarding the optical correction. Okay. Plus one diopter reduces? No. Plus one diopter plus will magnify. Plus will magnify. Myopic uses not convex, it uses concave lenses. Minus one diopter causes minification. Yes, this is good. High myopia is best corrected by magnifying devices. No, this is not true. Take care. High hypermetropia is corrected by magnifying. Correct. Okay. This is okay. Next. Which of the following statement regarding keratoconus are correct? Keratoconus are correct. Corneal collagen cross-linking is the only treatment which halts the progression. This is correct. Flea ring is due to calcium. No, it is due to iron. In the descemetes, no, it is not in the descemetes. It is in the stroma. Okay, in the stroma. Munson signs appears in the early. No, it appears in the late stage. Vogue disappear on applying pressure. Yes, this is correct. So 1 and 4. 1 and 4. ठीक है बेटा superficial stroma ठीक है iron deposition in epithelium or stroma iron deposition in epithelium or stroma epithelium ठीक है फिर epithelium होगा भाई but basically iron in is Fleischer ring ठीक है iron deposition in pterygium. What is iron deposition in pterygium? What is iron deposition in pterygium? It is Stocker line. It is Stocker line. What is iron deposition in this bleb? In bleb, in filtering bleb, in glaucoma. In glaucoma, Flarini Ferry. Ferry line, beta. Ferry line. Ferry line. Okay. Ferry line. Stocker line, ferry line, Fleischer ring. ठीक है. Kaiser Fleischer ring, KF ring is copper deposition. Is copper deposition. ठीक है. There is an iron deposition with age. There is an iron deposition seen in age. That is called as Hudson-Starley line. Hudson-Starley line. Hudson-Starley line. Hudson-Starley line. Okay, correct. These are the various MCQs which are there. Next, flame-shaped hemorrhages in hypertensive patient. Okay, flame-shaped hemorrhages. Why this happen? Why this happen? Flame-shaped hemorrhage. Because of the superficial coats of arterial venules. Superficial. और आवाज नहीं आ रही क्या? You're stuck. Your chat is stuck. All good. Why chat is stuck? Your chat is stuck. Now I am telling you, your chat is stuck. है ना? Lag. Lag, sir, lag. Chat lag. Now I get to say lag chat. अरे नहीं भाई, you were not. Fine. Now all fine. Now you are reacting. Why not? But a Henle's layer is at the fovea. Is at the fovea. Henle's layer is at the fovea only, beta. ठीक है? That is बदला सीरीज है ना? आईपीएल में चलते हैं ना बदला सीरीज. ठीक है? So this is रिवेंज सीरीज. ठीक है? चलो नेक्स्ट. करेक्ट. नेक्स्ट. Chlamydial conjunctivitis is true. Which of the following statements about chlamydial conjunctivitis is true? Spreads via direct fomites? Yes, true. Can lead to symblepharon, trichiasis, entropion as sequelae? True. Hair follicle, bulbar cadaver? True. Cerebral? True. All of the above. All of the above. ठीक है? Herbert follicle, all of the above. करेक्ट है ये तो. ठीक है. Trachoma is eliminated. Trachoma is eliminated. So bye bye. Bye bye to trachoma. Very soon we will stop studying about trachoma. But I think for this 1 year or maybe next 1 year, I think we'll have to keep teaching. Then everybody will forget about trachoma. Anna. Flame shaped mid heart exit. Nana beta, flame shaped is not heart exit. Beta, see here. There are two types of hemorrhages. So this is hemorrhages, beta. There are two types of hemorrhages. One is dot blot. One is dot blot. The other is flame shaped. The other is flame shaped. Flame shaped are superficial. ठीक है. Dot blot are deep. D for dot blot, D for deep, D for diabetes. D for diabetes. Okay. Flame shaped are superficial, more commonly seen in hypertension. More commonly seen in hypertension. Okay. In vascular diseases, like where the vessel will rupture because of hypertension, such as CRVO. Okay. Central vein occlusion. CRVO, because of the increase in pressure, they rupture. Okay. Correct. Next. Metamorphopsia, smokestack appearance. ठीक है. which test will help to differentiate this from early retinitis pigmentosa? Early retinitis pigmentosa. बाउंसर क्वेश्चन है ये. बाउंसर है ना? पहले सारा कुछ, the question is talking about CSR, then it is asking about retinitis pigmentosa. Then it is asking about retinitis pigmentosa. What is retinitis pigmentosa? Yaar, OCT will tell you about CSR. Okay. But retinitis pigmentosa is by ERG. ठीक है. For early retinitis pigmentosa, you have to do a ERG. You have to do. So, ये पूजा क्वेश्चन था. Yes. ठीक है. पूजा हो गया ना? ठीक है. पूजा हो गया ना? Then dark adaptation threshold नहीं है. ठीक है. It is early retinitis pigmentosa is by ERG. ठीक है. Good. ठीक है. Correct. Next. Question number next. Patient suffers blunt trauma to the orbit. There is sudden loss of vision. There is no MRI shows. Which optic nerve is most vulnerable to trauma? Which optic nerve part is most vulnerable to trauma? It is intracranicular part. I told you yesterday, I told you yesterday also, in case of fracture skull, okay, where there is head injury, there may not be any external injury. There may not be absolutely no external injury, but patient may get vision loss. Okay, patient will get vision loss. अरे all options करते करते तो बेटे बहुत, it will be a very long class. Beta, OCT will tell you about CSR, but how will you differentiate CSR from retinitis pigmentosa? How will you differentiate CSR from retinitis pigmentosa? How will you differentiate? OCT will not differentiate it from retinitis pigmentosa, beta. OCT in CSR will show fluid, whereas OCT in retinitis pigmentosa may show CME. So what will you get? Even when you, अच्छा ठीक है, those who are saying OCT, ठीक है, you have done the OCT. In CSR, it will show a fluid like this. In retinitis pigmentosa, you will get edema like this. See here, I told you yesterday in class. If we go to cystoid macular edema, ठीक है, रेटिनल वेन ओक्लूजन, डायबिटिक रेटिनोपैथी, CNVM, ठीक है, इवन retinitis pigmentosa can get. अच्छा इस पे नहीं है. I think it must be there in retinitis pigmentosa then. Retinal detachment, retinopathy of prematurity, CSR. ठीक है. There is CME. You can get cystoid macular edema also. In retinitis pigmentosa also, you can get CME. Cystoid macular edema can happen. Okay. See here, complicated cataract as a complication. So even CME can happen. Beta. ठीक है. So if you go to the question, OCT, you're done OCT. तब भी नहीं आएगा ना. So the best answer would be ERG. ERG CSR में normal होगा. ERG will be normal in CSR. But in retinitis pigmentosa, it will be abnormal. It will be not abnormal. Okay. Why not? Dr. Anjali asking, why not C? Why not C? Dark adaptation threshold. But बेटा बेस्ट, यार बेस्ट टेस्ट तो यही होएगा बेटा. इफ यू आर सेइंग बेस्ट, तो बेटा बेस्ट टेस्ट तो यही है, ERG है. ठीक है. इट इज फ्रॉम वेरी अर्ली. ठीक है, करेक्ट है बेटा. ठीक है. ऐसा कोई डार्क अडेप्टेशन टाइम तो आई एम नॉट अवेयर. ठीक है बेटा, करेक्ट. नेक्स्ट, चले आगे भाई. एक क्वेश्चन की है ऐसे, इलास्टिक बन गया क्वेश्चन का, च्युइंगम. ठीक है, इलास्टिक च्युइंगम मत बनाओ बेटा. ERG इज गुड. आंसर ERG है बेटा. आई अंडरस्टैंड. ठीक है. राइट टेम्पोरल लोब इंफार्क्ट, स्पेसिफिक विजुअल फील्ड डिफेक्ट. ठीक है. पैराइटल लोब लीजन शोज अ डिफरेंट डिफेक्ट. राइट टेम्पोरल क्या करता है भाई? राइट टेम्पोरल लेफ्ट सुपीरियर, राइट लेफ्ट इंफीरियर. ये 32 का ए. ठीक है, दिस इज करेक्ट. पाई इन द स्काई सुपीरियर, टेम्पोरल सुपीरियर, पैराइटल inferior, and right left, right left. Here it is showing right right, wrong हो गया. right right, wrong हो गया. right bitemporal, wrong हो गया. right left, right right, wrong हो गया. ठीक है, करेक्ट. सिंपली कॉन्ट्रालैटरल. चलो, ठीक है. नेक्स्ट, which of the following is true about hypermetropia? Shorter than normal eyeball. This is correct. Convex lenses are used. This is correct. Manifest hypermetropia, vision manifesting the competition. Acute ankylosing glaucoma is more common hypermetropes. This is correct. Self-share retina have you seen? This is correct. Okay, this is not correct. So this is the correct answer. ठीक है, this is the correct answer. ठीक है, correct. Manifest is of two types: absolute and facultative. Absolute and facultative. Okay, latent and manifest. Okay, latent and manifest. Manifest is two types: facultative and absolute. Facultative is which is able to by effort. Effort will cover this. Okay, not covered by effort. Not covered by effort also. Okay. MCQ. What is the method to find out how much is the latent? What is the method to find out how much is the latent? Okay. डिनर ब्रेक करना 9:30. हाँ 9:30 अगर होगा तो करेंगे. देखा, latent is by cycloplegia. Latent is by cycloplegia. Okay. Full cycloplegia. It is by how much is this? It is 1 diopter. What is the tone? 1 diopter. Okay. 1 diopter. Correct है. Next. Examiner if optic atrophy on the right eye, disc swelling in the left eye. Optic atrophy on the right side, disc swelling. Okay. It is because of compression of the right optic nerve and raised ICP affecting the contralateral eye. This is there. Okay. What is this called as? What is this called as? One side optic atrophy. Okay. One side optic atrophy plus other side edema. What is this called as? This combination is called as Foster-Kennedy syndrome. Foster-Kennedy syndrome. This is seen in frontal lobe tumors. This is seen in frontal lobe tumors. Okay, this is seen in frontal lobe tumors. Correct, Foster-Kennedy. What is pseudo Foster-Kennedy syndrome? There is a pseudo Foster-Kennedy also. Pseudo Foster-Kennedy syndrome. Pseudo Foster-Kennedy syndrome is seen in ischemic optic neuropathy. AION. Anterior ischemic. Where have you taught this? बहुत सारी चीजें हैं which we have not been. ठीक है. Beta, these are questions which come. This is how INICT asks, na? INICT. So this is basically we are aiming for INICT. ठीक है. Foster Kennedy is this. So this is where I am teaching you. I am teaching you. Yes. Ophtha में ऐसे ही bouncer आते हैं. Remember that question where we teach you petite canal and canal of Hanover, canal of petite and canal of Hanover. You remember that question? I can publicly say, even every educator on every platform, they did not know that answer. Nobody knew that answer. We all had to search. We all had to search. ठीक है? Nobody knew. We never did. ठीक है? So such kind of questions come to us also. Educators also don't know. Many times, Ophtha में such questions can come. ठीक है? But this is the question which is a standard. This is Foster Kennedy is a known topic. ठीक है? ठीक है? There are other syndromes also which are there. ठीक है? Correct? जैसे patient with alkali injury comes and you get a whether you will take history or whether you will take start washing the eye. ठीक है? Many educators were telling take history, take history, take history. I was always saying history is given in the question. You did not ask. You first wash and then while washing take history. That is what we used to do in our real life scenarios also. As soon as we used to listen A painter has come who's painting and tuna has fallen into the eye. Tuna is so toxic. Tuna is so toxic. It will form crystals, and that crystal will keep melting in the sclera. It will make a hole in the sclera. I have seen cases where the tuna has gone through the sclera into the choroid, and the choroid is coming out. Such horrible cases. Okay. So you don't waste time. We say never waste time in taking history. Just start washing first. Then keep. What is the harm in washing? Then keep taking history. Whatever history you want to take. Okay. So such kind of questions will keep bouncing, beta. Don't worry about them. Okay. Let us focus on learning. That is very, very important. Sudden onset, severe pain, colored halos, mid-dilated non-active, shallow anterior chamber, acute ankylosing from anterior uveitis. Anterior uveitis. It is IOP of more than 40. IOP of more than 40. Take care. Very simple question. This is very simple question. Okay, correct? Yes. So next, worsening of hot tub. Okay, she had painful. I don't. What is this phenomena called as? What is this phenomena called as? Ophtha phenomena. Yes. Ophtha phenomena. This is that. What is the other phenomena? What is the other phenomena? Pull fridge phenomena. Pull fridge phenomena. Okay. It is impaired depth perception. Impaired depth perception. Okay. Correct. Understood. Next. Progressive blurring of vision, difficulty in reading bright light, regular dilated pupil, but preserved accommodation. Take care. What is this? In previous question, myotis can be answered on myotic seen in uveitis, myotic pupil seen in uveitis. But finding able to yes, you can say that in glaucoma we will have a mid-dilated pupil. You can have a mid-dilated pupil, but in uveitis, so we are going to differentiate glaucoma from uveitis. So IOP more than 40 will be there. ठीक है बेटा glaucoma में will get a mid-dilated pupil and uveitis में you will get a myotic pupil. That is right. ठीक है but IOP of more than 40 is definitely glaucoma. ठीक है is definitely glaucoma. ठीक है rest are seen in uveitis. We want to find out which has glaucoma. Okay, correct. Next says deep tendon reflexes are decreased. Differentiates her from Argyll-Robertson pupil. ठीक है Argyll-Robertson pupil. Deep tendon reflexes are decreased in which? Tendon reflexes are seen in which? Ades pupil. Yes. Holmes Ades pupil. Holmes Ades pupil. And positive response to a diluted pilocarpine. Diluted pilocarpine is there. Okay, correct. Next. So, elevated intraocular pressure, negative sedal test after cataract surgery. This is the first patient. Second patient is hypermature cataract. This is malignant glaucoma and phacolytic glaucoma. Malignant glaucoma and phacolytic glaucoma. ठीक है Remember Cedars test? Cedar test. I knew. मुझे पता ही था कि Cedar test पूछोगे ही पूछोगे. What is Cedars test? Cedar test is basically a leak test. It is a leak test. Okay. Let us say if the patient has had a surgery and you have applied sutures here. You have applied sutures here. You apply a fluorescein dye here. You apply this fluorescein dye here. If there is leaking, then this fluorescein dye, because of the leaking, this fluorescein dye will flow down. Okay. Okay. If leak positive, then fluorescein dye flows down. Okay, this is how you find a leak test. Seidel test is this leak test. Understood now? ठीक है. Fluorescein dye comes in this form. It comes in the form of a strip. There is a strip like this. Okay, there is a strip like this which is there. It comes like this. Okay, orange color strip. Okay, there is a orange color strip here. Okay, this is a orange color, and this is how the fluorescein strip looks like. Okay, how to relate in malignant glaucoma? But after a cataract surgery, if there is a shallow anterior chamber, it can be either because there is a leak. It can be either because there is a leak. Okay, yes, or ठीक है, or it can be because of malignant glaucoma. ठीक है, understood? So it is very important to do a leak test. Correct है, समझ गए? Next, which of the following will differentiate from this hypertensive retinopathy from diabetic retinopathy? Hypertensive retinopathy from diabetic retinopathy, it is arteriovenous nicking and copper wiring. This is seen in hypertensive retinopathy. This is seen in hypertensive retinopathy. ठीक है. Hard exudate sarcinate pattern. Where is this seen? Hard exudate sarcinate pattern. Where is this seen? Diabetes. In diabetes, sarcinate pattern. Sarcinate pattern, beta. Hard exudate sarcinate pattern is seen in macular star. Macular star. Very good. Very good. Macular star. Macular star. Macular star. Macular star. Macular star. Macular star. Where is it seen? Macular star. Are it neuroretinitis? Neuroretinitis. Neuroretinitis. Yes, in neuroretinitis. है ना? And also in malignant glaucoma or malignant hypertension. Also in malignant hypertension, you can see this. Also in malignant hypertension, you can see this. ठीक है? But basically this. Correct है? So next question. अच्छा, Keith Wagner. Somebody is asking Keith Wagner. Beta, Keith Wagner classification. Keith Wagner classification is grade 1, grade 2, grade 3, and grade 4. Grade 4 is silver wiring plus papilledema. Plus papilledema. ठीक है? This is grade 4. ठीक है? Grade 3 is copper wiring. Copper wiring. ठीक है? Plus you have gun sign, bonnet sign. ठीक है? Here you have Salus sign. Salus sign come first. Salus sign will come first. Gun sign, bonnet sign come later. ठीक है? Gun sign, bonnet sign come. Obviously, Salman Khan ji पहले आएंगे ना. Salman Khan will come first. Later on, he'll bring a gun and bonnet. ठीक है? So Salus sign is first. Okay? Gun, bonnet. Then you have here, you have flame-shaped hemorrhages, hard exudate. Okay? Cotton wool spots. Cotton wool spots. These are all here. Okay? Here we have AV crossing changes start. AV crossing changes start. Okay, this is generalized narrowing. Generalized narrowing. Okay, this is there. AV ratio has started becoming 1:3. AV ratio has started becoming 1:3. Okay, very good. This is Keith Wagner classification. MCQ इसमें Salus sign. Which sign comes first? That comes as Salus sign. Okay, correct है बेटा. मल्टीपल स्क्लेरोसिस, ट्रांजिएंट ऑब्स्ट्रक्शन ऑफ विजन, ठीक है, बोथ पीपल कंसिडर ऑन ईयर एफर्ट, but not period poorly to, right? ठीक है, anisocoria for the under, okay, what is the most, there is a demyelination, is it the pretectal nucleus, ठीक है, accommodation reflex present but poor light reflex, fundoscopic is absolutely okay, fundoscopy is absolutely okay, correct, yes, ARP, like this is ARP, this is ARP, correct. Next, 500 microns. If each diopter requires 15 microns, flap is 110 microns. What is the maximum safe correction that can be done? What is the maximum? ठीक है, 500 minus 1110. How much is there? 390. Okay, 390 is left, out of which 300 is the residual stromal bed. So the gap is 90. For one, if you are doing 15, so for this, you will do a 6 diopter correction. You will do a 6 diopter correction. Okay, correct. Is this understood? Residual stromal bed is 300. ठीक है, ठीक है. Essential is minimum residual of 300 micron after LASIK. Okay, understood. ठीक है, मिनिमम इज, देख बेटा, इज इज ओके, व्हाट डज दैट मीन? ठीक है, लो बेटा सुनो, दिस इज द कॉर्निया, दिस इज द कॉर्निया, दिस हैज 500 microns. Out of this 500 microns, you have taken this 110 micron and you have lifted this like this. You have lifted it like this. ठीक है, you are lifted like this. So now what is left is 390 microns. Out of this 390 microns, you have to leave 300 microns. You have to leave behind. Leave behind. So this 90 microns, this 90 microns is what is, this is available for laser, available for laser, ठीक है. So 90 microns, so 90 divided by 15 is equal to 6 diopters, ठीक है. Why do you have to leave behind? We don't want to make a hole in the cornea. We don't want, yes, if you leave any less, if you leave any less, okay, then because of the, if you, let us say, if you do till here, okay, you remove all this and the thickness is this, so because of the intraocular pressure, patient will become keratoconus, patient will become keratoconus, okay. So you cannot, the cornea is required to maintain the integrity of the eyeball, beta, it is required to maintain the integrity, ठीक है. Yes, 470 से लेस आप कुछ भी नहीं करोगे. Okay, correct, understood. Is this okay, beta? Is this concept clear to you, all of you? Is this okay? ठीक है, ठीक, चलो. Next, next. This is one more thing which you will say, sir, ये कब पढ़ाया? ये भी नहीं पढ़ाया. सर आपने कुछ नहीं पढ़ाया. Sudden onset horizontal diplopia. ठीक है, is unable to abduct his left eye, has ataxia on the, ठीक है, difficulty in walking, ठीक है, no facial, unable to abduct, history hypertension. Hmm. Sudden onset horizontal diplopia, abduction defect, ataxia on the same side. There is no facial weakness. Yep, P. Abduction is basically your sixth nerve. Sixth nerve is gone. Ataxia. Okay. My question is, I think it is a north nagal. Better slow. These three syndromes, okay, are associated with third Kellner. These three syndromes are associated with third Kellner. Okay. Fowley syndrome is with the sixth Kellner. Okay. Correct. Now the mnemonic is when third person involved, okay, be we not cool. Okay. When third person is involved, be we not cool. Okay. So basically third kernel. So this is telling you that third kernel is involved. It results in various syndromes such as Benedict's, Weber, North Nagel, and Claude's. Okay, याद रहेगा. When third person is involved, है ना, husband wife के बीच, if the third person is involved, then BV is not cool. ठीक है, your BV will not leave you. Okay. Now, Benedict is, what will happen if your BV knows, what will happen? First, there will be tremor. There will be tremor. ठीक है. Then what will happen? Then there will be paralysis. Yes, hemiplegia. ठीक है. Paralysis is basically hemiplegia. ठीक है. Then what will happen? Then hemiplegia will go to the brain. So there will be cerebellar ataxia. Cerebellar ataxia. Cerebellar ataxia. Cerebellar ataxia. And then what is Claude's? Claude's is basically, now there is no V. It is a combination of Benedict's plus North Nagel. ठीक है. Claude's is, it's a combination. क्योंकि now there is no V. BB says now no more V. We are not V anymore. We are not V anymore. So there is no V. There is no V. How do you know this chronology? It's a secret. It's a secret. ठीक है. It's a secret between us. My BV should not know. Don't tell my BV. ठीक है. How I know this? ठीक है. चले. तो ये क्वेश्चन तो बाउंसर हो गया. यहाँ फेलियर ऑफ abduct नहीं होगा. If the question was failure to abduct, then the answer would be not negative. then the answer would be north nagal. But the question is, he is unable to abduct. ठीक है, पूजा हो गया ये. ठीक है, पूजा हो गया ये. ठीक है, तो आंसर शुड बी फोविली. इसके अंदर आंसर शुड बी फोविली, क्योंकि सिक्स नर्व तो उसी में इन्वॉल्व है. रेस्ट ऑल आर थर्ड नर्व इन्वॉल्व. ठीक है, करेक्ट. ठीक है, चले. फोविली में और क्या होगा? फोविली यार मुझे भी याद नहीं है. फोविली में मुझे भी याद नहीं. आई थिंक देयर इज सिक्स नर्व इन्वॉल्व. इप्सिलैटरल अटैक्सिया नहीं, कॉन्ट्रालैटरल अटैक्सिया. एवरीथिंग इज कॉन्ट्रालैटरल बेटा. एवरीथिंग इज कॉन्ट्रालैटरल. एवरीथिंग इज कॉन्ट्रालैटरल इन दिस. ठीक है, एवरीथिंग इज कॉन्ट्रालैटरल. ठीक है, करेक्ट. दिस वन टोटल चेंज सुप्रीम. दिस वन. I will see that question again. I will mark this question. I will see this question again, बेटा. ठीक है. 6-7 पर horizontal gaze palsy is fovally. Okay. 6-7 plus horizontal gaze palsy is no. Dilip sir told ipsilateral and not nagal. अच्छा, नॉर्थ नेगल में इप्सिलैटरल होता है. चलो, आई विल चेक दिस ऑल्सो. आई विल चेक दिस ऑल्सो. ठीक है, दिलीप सर टॉट. ठीक है, दिलीप सर की बीवी का इप्सिलैट, दिलीप सर का इसलिए इप्सिलैटरल होगा, उनकी बीवी अलग से होगी ना. माई बीवी विल कॉज कॉन्ट्रालैटरल. मे बी, डिपेंड्स ना, बीवी टू बीवी. ठीक है, ठीक है, चेंज कर देते हैं भाई, मान जाओ यार. लो, चेंज कर दे, डिलीट कर दे. ठीक है, चलो आगे चलें. 10-year-old girl with history of sinusitis present with proptosis, ophthalmology, fever, rapid MRI shows orbital abscess. इसका दिलीप सर ने क्या बताया था? ये दिलीप सर का क्वेश्चन है. दिस इज फॉर द दिलीप सर. ठीक है, immediate IV antibiotics and possible surgical drainage is there. ठीक है, correct. This is absolutely correct. This is your orbital cellulitis. This is orbital abscess. Okay, threatening the vision. Threatening the vision. ठीक है, correct. Except nothing all walls there is no. So it should not. ठीक है, okay, okay, okay. ठीक है. Difficulty in walking. Difficulty in walking. No facial weakness. क्या है? Except all involve seven cranial nerve. All involve seven cranial nerve. वेबर में भी सेवंथ होता है, फोविल में सेवन होता है. ठीक है, क्लॉड में भी सेवंथ होता है. ऑल हैव सेवंथ cranial nerve. I don't think so. I have not read this. ठीक है, let us. I'll put this question, Dr. Dilip sir also. ठीक है, चलो, let us do next. Enucleation is contraindicated in bilateral retinoblastoma cases. Evacuation increases risk of tumor spread. Is always avoided retinoblastoma. Yes, this is true. R is true. So this is C. A is false. R is true. A is false. R is true. Enucleation may be done in bilateral retinoblastoma. Why? If the retinoblastoma is a life-threatening disease. So in case of a bilateral disease, in case of a bilateral disease, ठीक है, to save life, you may do bilateral enucleation. You may do bilateral enucleation. Yes, we need to preserve vision. Agreed, Dr. Anukriti. Agreed. To save vision, we need to do that. But please understand that in case of an advanced case, we need to save the life. ठीक है, We need to save the life. ठीक है? How reason is true. बेटा evisceration you never do. बेटा evisceration is never done in tumors because it will lead to spread. It will lead to seeding. ठीक है? Evisceration is contraindicated. It is contraindicated. It is never done. ठीक है? You have to do a enucleation. Evisceration is also contraindicated in any other contraindication. Evisceration is also contraindicated in which other disease? Which other disease? No mucormycosis करते हैं. Contraindication. Yes, absolutely right. Symptomatic ophthalmia. In symptomatic ophthalmia. Yes, in symptomatic ophthalmia. ठीक है? Enucleation is contraindicated in. Enucleation is contraindicated in. Enucleation is contraindicated in. डॉक्टर सत्या आंसर ये है डॉक्टर सत्या. ठीक है? Enucleation is contraindicated in panophthalmitis. Panophthalmitis. Enucleation is contraindicated in panophthalmitis. नो बेटा एंडोप्hthalmitis में तो आप दोनों ही नहीं करते. Why? Please see here. If this is the eyeball like this, this is the eyeball like this, you have the meninges here. Okay, these are the meninges. Okay, they close here. They close here. So there is CSF here. There is CSF here. If you cut the eyeball, then the CSF is exposed to the infection. Then the CSF is exposed to the infection. ठीक है? So in case of panophthalmitis, you never cut hair. You never cut hair. Okay? You will only do evisceration. You do evisceration. ठीक है? Enucleation is contraindicated. Evisceration may be done. Evisceration may be done. Okay? Evisceration may be done. नहीं एक्सेंट्रेशन भी नहीं करेंगे बेटा. एक्सेंट्रेशन भी नहीं करेंगे. एक्सेंट्रेशन भी नहीं करेंगे. We will not do exentration also. So this is what I was telling beta. Okay? Evisceration is done for intraocular conditions. ठीक है? Intraocular. In case of a enucleation में हाँ. Yes. Absolutely right, Dr. Rohan. So if you cut the meninges here also, then also the CSF will get exposed to the infection, beta. Then also the CSF will get exposed to the infection, beta. Dr. Rohan Tyagi, it will get exposed to the infection leading to meningitis. It is very serious condition. Meningitis will then become a life-threatening disease. Meningitis is a life-threatening disease. ठीक है बेटा? So you never do. Okay, you never do this enucleation in panophthalmitis. Never ever. It's a contraindication. We do not want the patient to become life-threatening disease. ठीक है? Exentration is for mucormycosis, yes, and for metastasis. Beta, but eyeball has infection, na beta? Eyeball has infection. अच्छा एक बात बता मेरा बच्चा. Listen, Dr. Ashwin, Dr. whoever is getting confused, when your eyeball has infection, understood? Okay. When you are holding the eyeball, let us say you are holding this eyeball and you are pulling it out. Can you make sure that not even one bacteria gets left behind? Just think. You will not be able to remove every bacteria, na? Understand better. Very simple. There is pus, pus, pus. There is all pus. There is lot of bacteria, lot of infection. If you are cutting this open, then the CSF will start leaking. There is infection here. Even if one bacteria goes in, it will cause meningitis better. Okay? So even if you are removing the eyeball, you cannot make sure that every infection is getting removed. Okay? So you basically are trying to preserve this junction where it is solidly joined. Okay? You let it be. You drain this out. Okay? You drain this out and you wash inside with antibiotic. You wash inside with antibiotic, hoping that the infection recovers. Okay, correct. Is that understood, beta? Dr. Deepika, see, somebody is getting confused. In case of sympathetic ophthalmitis, what is the exciting antigen? It is this antigen. This is the uveal antigen. Uveal antigen. Okay. Let us say you are removing this. You are removing this. Okay. If even one cell gets left behind, then also it will cause antigen antibody reaction. For causing an antigen antibody reaction, even one antigen is enough to excite antibody production. So that is why in case of sympathetic ophthalmitis, you take the entire eyeball and cut, because then you are removing the entire uveal tissue. This is there. Okay, Dr. Deepika. So when you remove the entire eyeball, correct है? Understood? Thank you. चलो आगे चलें. Next question. Which of the following statement about tear film are true? Which of the following statement about tear film are true? Aqueous layer is secreted by the main acidic gland. Lipid layer prevents overflow and retards evaporation. This is true. Mucus layer is secreted by mucous glands. No, it is the lipid layer. It is the lipid layer which is secreted by mucous glands. Mucus layer helps convert hydrophobic corner surface to the hydrophilic one. Hydrophobic to hydrophilic. This is true. So this is true. This is true. Okay. 1, 2, and 4. 1, 2, and 4. Meibomian gland secretes the lipid layer. Meibomian gland secretes the lipid layer. Mucus layer is secreted by gland of Mans. Mucus layer is secreted by gland of Mans. Gland of Mans. ठीक है, gland of Mans. Goblet cells. Yes, also goblet cells. Also goblet cells. Okay, also goblet cells. Okay, correct. Next. Identify the pathophysiological process in the ulcer shown in the image below. This is C. Autoimmune destruction of stomach collagen with inflammatory infiltrates. Okay, this is C. What is this disease? What is this disease? What is this disease? This is the peripheral ulcerative keratitis. Peripheral ulcerative keratitis. PUK. 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 ठीक है. PUK, one form of PUK is Murren's ulcer. Murren's ulcer. ठीक है. This is a type of PUK. This is a type of PUK. What happens in wo? There is vasculitis. There is vasculitis of limbal vessels. Vasculitis of limbal vessels. Okay. This results in peripheral thinning. This is a thinning of peripheral cornea. because of epithelial cell loss. ठीक है? Treatment is by steroids. Treatment is by steroids. So this is another ulcer where steroids are given. This is another ulcer where steroids are given. Okay. What was the other ulcer where steroids are given? What was the other corneal ulcer where we have red steroids are given? Corneal ulcer where steroids are given. Any other ulcer? No, not bacterial. Not bacterial. Not bacterial. Shield ulcer. Absolutely good, Dr. Deepika. Shield ulcer. Shield ulcer seen in VKC. Seen in VKC. That is another ulcer where steroids are given. Okay, there steroids are given. Okay. This is Muran's ulcer, beta. कॉर्नियल नेवास्कुलर टू वेजेफ रिलीज वेजेफ कहाँ है इसमें वेजेफ नहीं है इसके अंदर बेटा इट इज बिकॉज ऑफ द वैस्कुलाइटिस इट इज बिकॉज ऑफ द वैस्कुलाइटिस ठीक है विद इन्फ्लेमेटरी इन्फिल्ट्रेट्स ठीक है इट इज बिकॉज ऑफ वैस्कुलाइटिस इट्स ऑटोमेटिक डिस्कशन ओके करेक्ट 50 पे करते हैं ब्रेक लेट अस टेक अ ब्रेक एट 50 47 क्वेश्चन 3 क्वेश्चंस एंड देन वील टेक अ ब्रेक Ptosis, bilateral epicanthus inversus, telecanthus, which of the following is most appropriate management plant? First is, yes, we have done this. Epicanthus and telecanthus first, followed by ptosis surgery. This is there. ठीक है? This is there. Correct है? भाई, you are right. कॉर्निया में वेजेफ तब आता है जब वायरल वो होता है डॉक्टर रोहन यू आर एब्सोल्युटली राइट वेजेफ नॉर्मली नहीं होता but to shrink the vessels, to shrink the abnormal vessels, in case of a viral corneal neovascularization, we can give a anti-VEGF in the corneal stroma. We can give an anti-VEGF in the corneal stroma to shrink the normal vessels, to shrink the abnormal vessels. Okay, correct. A patient undergoes a refractive procedure, small lenticle is removed with no flap creation. No flap creation. What is this? This is smile procedure. This is smile procedure. We have done this. Okay, smile procedure. ठीक है. In pseudomembranic conjunctivitis, membrane can be peeled without bleeding. This is true. In form of oil for intact without involving a deeper connective tissue. Both are true and R is correct explanation. This is true. ठीक है. This is okay. These are okay. ठीक है. Next question. Using indirect fundus, which is the following feature indirect from direct fundoscopy. Upright image. Indirect में, it is not an upright image. It is an inverted image. This is correct. Periphery, this is correct. It is not a smaller field, it is a wide field. Upright image is not there. This is inverted image with a okay, correct. Let us take a break. Okay, dinner break. Let us have dinner and then we'll do the rest of the 25 questions. Okay. Let us take a break and we'll come back in half an hour. Okay. Pseudomembrane is mostly caused by staphylococcal and streptococcal species, beta. Okay. Pseudomembrane is by staphylococcal and streptococcal, beta. Okay. Correct. Okay. Let us take a break. So, read more. If Ophtha is difficult, then read more. Dr. Michelle, every subject is difficult if you don't understand it. But if you try to understand it, it is easy, beta. Okay? We'll do. Okay? We will keep doing. This one, Dr. Nadia. Dr. Nadia. This one, beta. Okay? Question 37. बेटा ऑफ्था है ही ऐसी. ऑफ्था इज लाइक दैट ओनली. It is like this only. Question 37, beta. Dr. Khwab Gupta. Doctor Saab, this is AD's pupil. Very simple, beta. Is poor levator function in all performance? Poor levator function. Yes, it is mostly poor, beta. Okay, but the amount of ptosis is quite severe. But it is mostly poor. Chale, let us take. I'll come back in a short time. Lul. Very good. 55 diabetes present progressive loss of vision. No media clarity due to dense cataract, which will most effectively help visualize the retinal condition in this scenario. Retinal condition in this scenario. Please remember, in all cases of mature cataract, we have to do a B scan for posterior segment evaluation. Okay, that is done to see if there is any retinal detachment. Okay, if there is any RD. Rest, it is always a guarded visual prognosis. We always have to tell a guarded visual prognosis because we can never tell about the functional integrity of the retina. We can never tell about the functional integrity of the retina. Okay, correct. So we always do a B scan. Correct. Good. Good. Next. Next question. Question 52. Best disease, EOG shows abnormal ardent ratio, ARG. Now, what is the most characteristic implication of this pattern? अरे तो self explanatory हो गया. It is the best Whitley-Found district. ठीक है. ERG is abnormal. ये तो question ही leak हो गया. ठीक है. So basically, in best disease, when you do a EOG, you measure the Arden ratio. This I have told yesterday also. In Arden ratio, you measure the ratio of the peak to trough ratio. Normal is more than 2.0. Doubtful is between 1.5 to 2. If it is less than 1.5, it is abnormal. If it is less than 1.5, it is abnormal. Is there? Okay, correct. So it's best Whittle-Found dystrophy. Stargardt disease is a variant of this. These are the two variants which are there for the hereditary macular dystrophy types. That is the variant. Okay, correct. What is the fundus appearance like? It is a egg yolk like appearance at the macula. Egg yolk like appearance at the macula. Egg yolk like appearance at the macula. Okay, correct. Okay. My next question, question 53, regarding ocular media and refractive contribution. Nucleus is are true. Are true. Nucleus is higher than that of cortex. This is true. So these two are out. These two are out. Vitreous humor has nearly identical. This is true. Okay. So answer is automatically 1 and 2. Answer is automatically 1 and 2. Okay. Posterior corneal surface is more powerful than no, it is the anterior because it is the air cornea interface. है ना? Air cornea interface. Remember? Anterior lens surface contributes more than the posterior. No, because posterior there is more change. There is more change. Okay, more curvature. Dominated by lens? No, it is dominated by the cornea. It is dominated by the cornea. Okay, correct. Understood. Very good. Chalo. Alpha agonist, brimonidine is avoided in infant with glaucoma. These agents cross the blood-brain barrier. CNS depression. Both A and R2 and R is correct expression of A. This is absolutely good. This is absolutely good. है ना? This is the correct. Okay. Next, long-standing type 1 diabetes, microaneurysm, thickening within 4 5 microria. Strategy most appropriate to reduce vision-threatening edema. What is vision-threatening edema? It is use of anti-VEGF. It is use of anti-VEGF. Okay, good question. Good question. Dr. Astha. Okay, everybody who is saying B, please remember, whenever you will do PRP, what is PRP? What is PRP going to do? What are you going to use in PRP? What are you going to use in PRP? Laser. Absolutely good. What is laser? It is energy. What will energy lead to? It will lead to inflammation. What will inflammation lead to? Macular edema. Understood? So whenever we do PRP, there is worsening of edema. So if there is already edema, you would first give an anti-VEGF injection, settle the edema, and then do a PRP. Okay? So see here, it is already saying that there is thickening within the, so there is already edema. Okay, understood? Is this clear to everyone? Is this clear to everyone who was saying B, 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 B? So it is not BB, it is CC. Okay, correct. Understood why we are doing this. Cataract stenosis, monocular vision loss, curtain descending, cherry red spot, pale retina, which is the most probable source of, it is the cataract plaque. Obviously, it is the PRP isn't done for NPDR, right? हाँ ये भी है. PRP is also not done for NPDR. There is no PDR as of now. Very good. That is also a valid point. That is also a valid point. There is no PDR. The question is not mentioning any new vessel formation. The question is also not mentioning any new vessel formation. So this is basically a NPDR with CSME. The diagnosis in this case is NPDR with CSME. Yes, anti-VEGF can be given in CSME, beta. Anti-VEGF can be given in CSME. And NPDR can be given in CSME. Okay, correct. Yes. Next, 2-month-old, early onset. ठीक है, cryogene, co-structure protein. What does it encode? It encodes the crystalline protein. ठीक है. Follow up. किससे follow up? NPDR management is just observation, बेटा. NPDR में follow up नहीं है. NPDR का management would be control of sugars. NPDR management would be control of blood sugar, control of hypertension, cholesterol, kidney disease, anemia. Okay. सबसे important, which I keep telling all of you, but you don't listen. I know you don't listen. Those who don't, you are my favorite ones. Those who do, Stop smoking. It is a very horrible thing. It's a very horrible thing. Good, good. You should not. It's a very horrible thing, has long-term consequences. I have lost a friend because he used to smoke and he landed up with a esophageal carcinoma. ठीक है? नहीं करो, बिल्कुल मत करो. Painful red eye, intercroration is found to be elevated. What is this? Hypermature cataract. Hypermature cataract, Morgagnian type. Morgagnian type, hypermature cataract. Very, very simple. Very simple case. Okay. Flame shed torches, hemorrhages in all quadrants. Hemorrhages in all quadrant. Which of the following feature best differentiates from the central artery occlusion? Central artery occlusion. It is neovascular glaucoma development at 90 days. Will happen in this condition. Chariot spot will happen in CRO. This is CRO. Okay. CRO. Okay. ठीक है. It is more commonly seen in the ischemic type. It is more commonly seen in the ischemic type where the vision at presentation is poor than 6 by 18. Where the visual acuity is poor than 6 by 18. Sudden loss of vision will be in both CRAO and CRVO. Both CRVO, CRVO. ठीक है. Correct. Yes, the condition is CRVO, beta. Tortuous vein, flame-shaped hemorrhages, macular edema, hyperlipidemia. ठीक है. Capillary non-perfusion. Non-perfusion is basically denoting the ischemic type. Non-perfusion is basically denoting a ischemic type. ठीक है. Correct है. Next question. Central lateral artery occlusion. Optic pallor of optic atrophy is most likely present. CRAO. CRAO results in what type of? Beta CRAO. 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 Yes, it is primary beta. CRAO में प्राइमरी होता है. ठीक है. CRVO में वो होगा. CRAO will result in a primary optic atrophy beta. कहाँ है? न्यूरो ऑफ्था, स्ट्रैबिस्मस, रेटिना towards RD and ERA. Optic atrophy. Okay. Without the optic nerve head swelling, ठीक है, it will be CRAO. ठीक है. CRAO will be here. ठीक है. CRAO will be here. It will not be consecutive beta. CRAO, it will not be consecutive. It will be CRAO will result in a primary beta. ठीक है. See, consecutive is where you are able to see the problem inside. Okay. So that retinitis pigmentosa, vasculitis there. CRAO results in a primary optic atrophy. CRAO results in a primary optic atrophy beta. ठीक है. Understood? There is only disc pallor. CRVO will result in secondary. In BTR, it's given consecutive. In BTR, it is given consecutive. नहीं बेटा, it will not be consecutive. Now, CRAO will be primary. Okay, chalo. So, what I'll do is, I will mark this question also. So this is the second question that I marked. You are saying BTR is saying consecutive. BTR is saying consecutive. I'll just verify. Okay. CRVO will result in secondary. CRVO will result in secondary. Sparrow 2. CRAO will result in a primary optic atrophy. ठीक है. CRAO results in a primary optic atrophy. Optic pallor, optic disc. Beta, but optic disc will be pale. ठीक है. Only the optic disc will be pale. Rest, the red will be normal. The vessels will be gone, but they will not be pigmented. Later on, there is reperfusion. Later on, there is reperfusion, but because of retinal ischemia, okay, the retinal cells have died, are dead. So the vision does not come back. But reperfusion happens later on. हाँ मेरा बच्चा, ठीक है, there is reperfusion of the vessels. चैट जीपीटी 60% करेक्ट. चैट जीपीटी भी कह रहा है. चैट सीआरएओ से अरे चैट जीपीटी को छोड़ दो बेटा. चैट जीपीटी को छोड़ दो. लेट अस सर्च अमेरिकन एकेडमी ऑफ ऑप्थेल्मोलॉजी. ठीक है. चैट जीपीटी को छोड़ दो, अमेरिकन एकेडमी को देखो. ठीक है. अगर देखना है तो अमेरिकन एकेडमी को देखो या पार्सन्स देखो. एनीबडी हैज एक्सेस टू पार्सन्स? Anybody has access to Parsons? I do not have it right now. I'll check it. Let us get the class over. Once the class is over, towards the end, I'll search. ठीक है. I'll search. ठीक है. CRAO is primary optic atrophy. We will do this. Next question. Is your type 1 diabetes? Find the concave RD. Concave RD. Concave RD. And neovascular. What is pathology of this condition? There is fibrovascular contraction exerting traction. There is tractional RD. There is tractional RD. There is tractional RD. खुराना भी सेकंड. खुराना को छोड़ो भाई. पार्सन पार्सन पार्सन. Always follow पार्सन. ठीक है. Next question. 29 present with bilateral night blindness. Fundamental bone spicules. ठीक है. Which is there. For which they have differential from CSR. It is tunnel vision and loss of rod function, which is there. This is the retinitis pigmentosa. This is a feature of retinitis pigmentosa. Okay, in the chapter on the retinol, it says consider. ठीक है, agreed. Dr. Soumya Mishra has put the Parsons, which says CRAO. Thank you, Dr. Soumya. So then it becomes consecutive. Okay, ठीक है. Agreed. Consecutive. ठीक है. I agree. NIH also says consecutive. ठीक है बेटा. Agreed then. ठीक है. Beta, we are talking about the finding of the retinitis pigmentosa. We are finding about the retinitis pigmentosa. So what is beta? It is what is the finding of retinitis pigmentosa? It is tunnel vision and loss of rod function. ठीक है. Last is the finding of CSR. ठीक है. Smokestack appearance and fluorescein angiography, which is a finding of CSR. ठीक है. Okay, correct. Itching, photophobia, doping curve discharge, cobblestone appearance. What is the type of hypersensitivity? It's a type 1 hypersensitivity with eosinophilic aggregates. With eosinophilic aggregates, this is very clear. ठीक है. What are these? These will lead to Horner Tranta spots. Horner Tranta spots. These are the eosinophilic aggregates. These are the eosinophilic aggregates. Correct है? Yes. Gradual loss of vision, well-defined 60-year-old, hypertension, smoking, R RP thinning, conversion from dry to wet ARMD. Dry to wet ARMD. It is CNVM. Presence of CNVM. Okay. Wet ARMD is CNVM. Okay. For this, we give anti-VEGF injections. Anti-VEGF injections. Okay. Next, NICU 4 weeks. New vessels in zone 1 spanning 6 clock hours. Okay. No RD. What will you do? You will do a intravitreal anti-VEGF injections. Okay. Intravitreal. So more than 5 clock hours. More than 5 clock hours. Beta, more than 5 clock hours in the zone 1. ठीक है. New vessel formation in zone 1. ठीक है. Okay. This is in zone 1. New vessels are forming in zone 1 in more than 5 clock hours. It is a threshold disease. Beta, new vessels are forming na, tortuous new vessels. ठीक है. At 1 month तो वैसे भी नहीं होता. वैसे भी अगर होता है तो it is a 2-week follow-up. And if it is so much, then it is a weekly follow-up. ठीक है. 1 month is too long a time. ठीक है. 1 month is too long a time. ठीक है. 1 month तो definitely नहीं. It is too long a time. हाँ, agreed. Stage 3 or more, I agree. But see, new vessels are forming. If there is an extra retinal proliferation, stage 3 is extra retinal proliferation. And now what is stage 3? Stage 1 is demarcation. Stage 2 is ridge. Stage 3 is new vessels are coming out. Okay, beta, Dr. PK need. Stage 3 is new vessels are coming out. ठीक है. Stage 3 or more. And anyways, even if it is there, 1 month follow-up is too long a time for zone 1. Zone 1 is the central zone. It is, you cannot wait for 1 month. Patient will straight away land up in RD. ठीक है. Patient will lose the eye. The child will lose the eye. ठीक है. 1 month is too long a time, beta. ठीक है. Correct है. Understood. Next. In flags, instead under which of the following steps is specifically automated by laser diffraction conventional? It is the capsular axis. It is the capsular axis. Okay. Cystic species macula, OCT short effective is the following most effective, most likely be ineffective in this patient's management. Okay. It is PDT. I told you yesterday also, it is obsolete now. It is an obsolete now. बेटा PDT is obsolete now बेटा. इसी की बात हो रही है ना. अच्छा इसका hello lag. There is no response to this question. There is chat lag. Lag in the chat. No lag. No lag. No sir. ठीक है. You are here. तो मुझे लगा चैट में लैग हो गया. ब्रेन लैग हो गया. ठीक. ठीक है. So PDT is obsolete now. NSAID you will give intravitreal steroid injection. We have done Ozurdex. We have done Ozurdex. ठीक है. Orestazolamide has also been proven to have some role. ठीक है. Diamox can be given. Okay. But PDT is absolutely obsolete now. ठीक है. Acute ankylosing glaucoma. Acute ankylosing glaucoma resolves spontaneously. बिल्कुल भी नहीं. It never resolves spontaneously. Chemosis, mid-dilated fixed pupilla characteristic. Yes. ठीक है. One out, one out, one out. So this is the correct answer. ठीक है. Acute ankylosing glaucoma never resolves spontaneously. ठीक है. Acute ankylosing glaucoma never resolves spontaneously. Include rainbow halos and rapid loss of vision. Involves pilocarpine and laser iridotomy. Pilocarpine and laser iridotomy. This is the treatment. Correct है. Is this okay to all of you? This, I'm sure this you all must have done rightly. This you must have done right. Oh, Akansha, why not? Dr. Akansha, why not, beta? Bilateral painful red eye, blurring last 5 days, surgical repair. Okay, trauma 1 month ago. Trauma 1 month ago. Yellow white lesion at the level of RP. Okay, what are these? These are Dale and Fuchs nodules in the posterior segment. These are Dale and Fuchs nodule in the posterior segment. Okay, correct. Easy peasy. It was easy peasy. ठीक है. 22 man presents with acute onset vision loss in right eye, difficulty in perceiving colors, normal optic disc, MRI is planned to demarcated. It is a retrobulbar neuritis. It is a retrobulbar neuritis. This was also easy peasy. This is also easy peasy. ठीक है. Correct. Next. Pediatric glaucoma are true. Goniotomy requires a clear cornea for visualization. Yes. Trabeculectomy is advanced opaque cornea. Yes. Drainage implant. Yes. Mitomycin is prevalent in first line. No, it is not used as first line. It is not used as first line because it can cause hypotony. The goniotomy. Goniotomy. अच्छा ये भूल गए goniotomy. See here. I'll show you this. See here. Goniotomy. Goniotomy भूल गए. Where is ये रहा. This was goniotomy. This was goniotomy. Remember? So in goniotomy, the examiner has to look from here and see the angle. See here. So the examiner has to put a lens here. He puts a lens here. Okay, he puts a lens here. And through the lens, he sees this angle and then operates. To operate here, you need a clear cornea. You need a clear cornea. It will not be possible to do a goniotomy without seeing. Okay. Okay. Beta, in trabeculectomy, what we are doing is, in trabeculectomy, what we are doing is this. See here. What we're doing is, we are from the above, we are going in. We are going in and we are cutting. Okay. Is that okay? Dr. Vaishnavi, is this okay, beta? You go from here and you are cutting from inside. Okay. Dr. Shishti is asking why we do not give mitomycin. Because mitomycin drastically reduces the scarring. It is not possible to titrate the response of scarring. Okay. So as a first line treatment, you do not use mitomycin because you do not want a hypotony. Okay. Sometimes this drains so much that the IOP goes down. Okay. So you do not want. Yes. Okay. If it is refractory, then we can, in case of a repeat, we can do. Okay. Correct. Understood? Very good. Coming back to ENT. Yeah. Okay. Next question. Chronic opal IOP is constantly elevated. Most resistance to aqueous outflow is from Schlemm's canal. Which part? Which part? Absolutely correct. It is juxtacanalicular part. It is juxtacanalicular part. Okay, it is juxtacanalicular part. Okay, so it is juxtacanalicular means the part which is besides the Schlemm's canal. Besides the Schlemm's canal. Okay, this is the juxtacanalicular meshwork. Okay, correct. This is the most resistance to aqueous outflow. Correct. Understood. Yes, I can see it is shortest line. ठीक है. Perimetry with scotoma in Jerem's area. It will lead to what? Which type field very most likely progress to? Lead to a arcuate scotoma. Result in a arcuate scotoma. ठीक है ना? It will progress to a arc type scotoma. हाँ, Seedles, but Seedle is not in the choice. Seedle is not in the choice. After Seedle, it becomes arcuate. After Seedle, it becomes arcuate. ठीक है? Not central, not homogeneous, not concentric loss, not peripheral loss. ठीक है? Next, there is no axial elongation, but nuclear sclerosis is evident. Which type myopia does most likely present? Very easy question. It is index myopia. It is index myopia. Okay, correct. And the next question is vertical diplopia. Looking to the right. Yes, right hypertropia. Park 3 steps is performed. Park 3 step test is performed. You are asking, who was asking? Park 3 step मेरी जान ले रखी थी. Park 3 step test. This is the reason this question is there. What is this Park 3 step test? कौन I was? कहाँ गया वो I was? Somebody was saying I was taking. मेरी जान ले रखी थी उसने. है ना? What is the Park 3 step test? See here. So let us assume the patient's right eye and this is the patient's left eye. Right eye, left eye. Yes, Dr. Astha. Absolutely right. So, see, patient has right hypertropia. So the right eye is up. That means the depressors, basically, this is to identify the paralyzed muscle. This is to identify the paralyzed muscle. ठीक है? Agreed? Now see, so if this eye has gone up, that means this eye depressor is paralyzed. What are depressors of this eye? The depressor of this eye are inferior rectus and superior oblique. Inferior rectus and superior oblique. Or the other possibility is that this eye elevator are paralyzed. This eye elevator are paralyzed. But this eye, this is a possibility, na? That this eye has truly gone up, but this eye has not gone up because the elevators are paralyzed. And that's also a possibility that the patient is looking up. So this eye is going up, but this eye is not going up because the elevator is paralyzed. Understood? Correct? So what are the elevators of this eye? They are superior rectus and inferior oblique. Superior rectus and inferior oblique. Correct? Now, see, the next point is patient is saying that on looking to the right and on tilting to the head, right? So let us first start with looking on the right. there is vertical diplopia. ठीक है, on looking to the right there is worsening. ठीक है, on looking to the right there is worsening. So when the patient is looking to the right, okay, the eye is abducted and this eye is adducted. This eye is adducted. In an abducted eye, the elevation and depression is by the recti. And an adducted eye, the elevation and depression is by the obliques. ठीक है? So in an abducted eye, the elevation depression is by the recti. In adducted eye, the elevation and depression is by the obliques. So this strikes of this oblique is gone, rectus will remain. Okay, here rectus is gone, oblique will remain. So in the first step, you get 4 muscles. In the second step, you get 2 muscles. In the second step, you are left with 2 muscles. Okay, is this okay? Is this okay till here? Now see, on tilting his head to the right, there is worsening. On tilting his head to the right, there is worsening. Now just think yourself. If I'm tilting to the right is undergoing intorsion, left is undergoing extorsion. Okay. So when you tilt, there is intorsion and there is extorsion. Okay. Correct. Intorsion is by the superiors are intorters. Superiors are intorters and inferiors are extorters. Superiors are intorters and inferiors are extorters. Superior is, there is no superior here. There is no superior here. ठीक है? There is an inferior here. Okay, there is an inferior here. So the correct answer is inferior oblique. So the correct answer is inferior oblique. So the correct answer is inferior oblique. Have you understood the third step? बिल्कुल जाता है बेटे, बिल्कुल जाता है. Okay, Dr. Venkat, Dr. Manas, Dr. Akash. नहीं, I'll start again from the first step. I'll start again from the first step. I'll start again from the first step. Yes, I'll start again. Not an issue. I'll start again. Beta, see, first and foremost, this is a question that you students ask. I do not normally teach because I also know that one, this question will not come. I also don't expect this question to be given to an undergraduate. It's a difficult question. Okay. Second, it's a lengthy problem. Okay. No matter how much time in an exam, you require a lot of you want to be very fast. Okay. It's a lengthy problem. Okay. So it is there. Okay. But yes, if you want to understand, it is possible. Okay. But I have never seen. Have you ever seen any question in previous year? Has it ever come in a PYQ? Have you ever seen in a PYQ, PYT? Has anybody ever seen this in a PYQ, PYT? It might be there in some Q banks, especially those arrow ones. ठीक है? INICT में वंस यार, ठीक है. तो भाई मेरे से तुम नीट पूछ रहे हो, हाँ? और फिर चारों की बातें करते हो, चारों की. डैम CBT. हाँ, सी damn it, DAMN, damn it. ठीक है, आ जाओ. Let us repeat it again. Let us see it again, बेटा. See, जिसके सिर के ऊपर से गया है, for those who have not been able to decipher what is happening, But first, focus on this diagram. First, you should be knowing about this diagram, which is very, very important. Only then we can talk about something else. Okay? See this diagram. Focus on this diagram. Okay? Focus. This is the right eye. This is the left eye. Okay? I was telling you that when the eye goes out, the elevation and depression is by the recti. They see superior rectus, inferior rectus. Okay? When the eye goes out, it is by recti. See here again, left eye. When the eye goes out, the elevation and depression is by the recti. ठीक है बेटा? Is this clear till here? Next. So one remember this. Whenever the eye goes out, the elevation depression is by the recti. When the eye goes out, the elevation depression is by the recti. Second point. When the eye goes in, the elevation depression is by the obliques. So when the eye goes in, the elevation depression is by the obliques. Similarly here, when this eye will go in, the elevation and depression is by the obliques. Okay? So if this eye is, if both the eyes are going like this, if both the eyes are going like this, one eye recti are acting, other eye oblique are acting. Okay? First, remember this concept. This is a very important concept. Only if you understand this first, then you can understand rest of the things. Okay? So when the eyes go in one direction, the recti act in one eye, obliques act in the other eye. Okay? If yahan tak it is clear, then you can think about other things. Now see. Now come back to the question. Okay? See. Patient has right hypertropia. So in the first step, identify the hypertrophic eye in primary gaze. Okay? In the first step, identify the hypertrophic eye in the primary gaze. So here it is right hypertropia. If the right eye is up, that means right side depressor is not working, or left side elevator is not working. What are the right side depressors? What are the right side depressors? Right side depressors are inferior rectus and superior oblique. Right side are, yes, right inferior rectus and right superior oblique. Left side elevators are left superior rectus and left inferior oblique. Okay? Correct? Is this okay? So, see here. Okay? Inferior rectus, superior oblique and inferior oblique, superior rectus. Okay? Elevators and depressors. Is this okay till here? Now, in the second step, when you go to the second step, see the gaze. What happens with gaze? What happens with gaze? Okay? In gaze, this is saying that on right gaze, there is hypertropia. That is, on right gaze, there is hypertropia. That means when the eye is going like this, and when the eye is going like this, so this is the left eye, this is the right eye. This is the left eye, this is the right eye. So when the eye goes out, so when this eye goes out, here the recti will act, here the oblique will act. Here the recti will act, here the oblique will act. Okay, so this is out and this is out. Understood? Have you understood the second step? So when the eye goes out, the recti will act on depressors and elevators. Here the eye has gone in, so the oblique will act as elevator and depressor. So this is second step. Correct hai? So you are left with the two muscle. It is elevator depressor is by the recti. Here the elevator depressor is by the oblique. So you are left with right inferior rectus and right inferior rectus and left inferior oblique. Left inferior oblique. Okay. Now in the third step, see the torsion. See the torsion. It says right head tilt. Right head tilt. When you do a right head tilt, the right side, when you do a right head tilt, the right eye will undergo intorsion and the left eye will undergo extorsion. Okay, and we know that superiors are intortus and inferiors are extortus. Inferiors are extortus. Okay, so there is no superior here. There is no superior here. There are both the inferiors. So by this we reach the final diagnosis, left inferior oblique. We reach the final diagnosis, left inferior oblique. Is this okay? I hope everyone is understood. ठीक है, correct है, पार्ट 3 स्टेप टेस्ट. ठीक है, okay, okay, correct, okay. What I did, अरे यार मैं अभी विकास भाई आप सुन रहे हो तो प्लीज यार एनोटेटेड नोट्स कल के नहीं पहुंचे हैं बच्चों को, प्लीज सेंड देम. ठीक है. इंफीरियर रेक्टस नेवर एक्टॉर्ट. इंफीरियर रेक्टस नेवर एक्सटॉर्ट्स. इंफीरियर रेक्टस एक्सटॉर्ट करता है. कहाँ गया वो बच्चा? इंफीरियर रेक्टस एक्सटॉर्ट करता है डॉक्टर विश्वनाथ जैना. बट बेटा राइट आई इज इंटॉर्टिंग ना बेटा, बिकॉज राइट आई इंटॉर्शन हो रहा है. तो एक्सटॉर्शन होगा कैसे? राइट आई is getting intorted. Left eye is one which is getting distorted. Okay, so that is why left side का बचेगा ना बेटा. Right eye, yes, inferior rectus will extort, but here it is happening in torsion. ठीक है. Okay, डॉक्टर जेना, is this okay बेटा? ठीक है. गुड. ठीक है, चले भाई, छुट्टी. हैप्पी हॉलीडेज. एक भाई ने क्वेश्चन भेजा है, मेरे पास पहुंच गया क्वेश्चन. अरे ये क्या हुआ? अरे क्वेश्चन दिख, आर यू एबल टू सी माय स्क्रीन नाउ? बिकॉज आई एम नॉट एबल टू सी माय स्क्रीन. हैं? यू आर, व्हाट इज दिस? आई एम नॉट सीइंग माय स्क्रीन. मेरी स्क्रीन गायब हो गई और तुम लोगों को स्क्रीन दिख रही है. कहाँ है स्क्रीन यार? हाउ इज दिस हैपनिंग? आई एम नॉट सीइंग माय स्क्रीन. वेयर इज इट गॉन? मेरे साथ 2-3 बार हो गया ये. पता है स्क्रीन में. हाँ, भूत, सीरियसली. माय हॉस्पिटल नेम, रेडिया माय सेंटर. If you are interested in seeing interesting cases, you can come to my center. Most welcome. Somebody wants to see interesting cases, you can come. भैया मेरे को 2 क्वेश्चन में डाउट है. एक तो वो क्वेश्चन नंबर 60 था, कौन सा था? प्राइमरी ऑप्टिक एट्रोफी. आई एम स्टिल नॉट कन्विंस्ड. ठीक है, पर कोई नहीं. ठीक है. और एक क्वेश्चन था वो डॉक्टर दिलीप सर वाला. ठीक है, फोविली सिंड्रोम. ये 2 क्वेश्चन आई साइन. No, please 51 repeat once I missed it. 51 में कुछ था ही नहीं बेटा मेरे ख्याल से. Must have been a very simple question. हाँ. Diabetic will present with vision loss. No media clarity. No media clarity due to dense cataract. Effective visual condition. It is B scan. When mature cataracts, we do B scan for posterior segment evaluation. Posterior segment evaluation, and you always take a guarded visual prognosis. ठीक है. You always take a guarded visual prognosis because you cannot tell the functional integrity. Sometimes patient may be having a ARMD, dry ARMD. Okay. Sometimes the patient may be having a macular hole. There have been cases where the patient has a macular hole. Then even after a cataract surgery, patient gets no vision. Okay, patient gets no vision. Okay. अरे डिस्काउंट है बेटा, खूब डिस्काउंट है. Anybody wants to get, I don't charge any fee from my doctor friends. ठीक है. I do it at my cost basis, whatever is the cost. ठीक है. I don't charge my personal fee. तो बाकी जो कॉस्ट होगा. क्वेश्चन 26. क्वेश्चन 26. 26 36 26. 26 36 26. वन डायप्टर रिड्यूस क्या करता? प्लस वन डायप्टर मैग्नीफाइज. प्लस वन डायप्टर मैग्नीफाइज. ठीक है. गुड. सेंटर नेम रेडियम सेंटर बेटा. ठीक है. चले. We will do all this on WhatsApp. Okay, WhatsApp. Yes, paper was tough. Paper was tough, I believe, because my aim was to teach you today also. ठीक है. अब there is still time to go. I wanted to teach you. I believe I have taught some new things to you. ठीक है. You have learned something new. ठीक है. So that was my aim to give you this. It was because it was not very close to exam. So I thought ki let me take this chance to teach you rather than give you an easy paper and boost your pseudo morale. I don't want to boost your pseudo morale. Okay, wanted to give you something hard. Good. चलो. ठीक है. Most welcome. Thanks a lot. Trabeculotomy and goniotomy are same. Trabeculotomy is basically from the outside. Goniotomy is on the inside, beta. Trabeculotomy is on the outside. ठीक है. Good night. Yeah. Okay. मैं अभी पीडीएफ कर रहा हूँ. आई हैव ऑल द पीडीएफ विद मी एंड आई एम सेंडिंग द दिस पीडीएफ ऑल्सो. ठीक है. एंड इन केस इट हैज नॉट बीन शेयर्ड विद यू, आई विल मैसेज टू एवरीवन इन द टीम टू सेंड द पीडीएफ टू यू. अच्छा, व्हाट्सएप लिंक. लेट मी फाइंड द व्हाट्सएप लिंक. तो मेरा व्हाट्सएप तो नहीं देख रहे तुम? तुम्हें मेरा व्हाट्सएप तो नहीं दिख रहा ना? इसमें कुछ वो वाले दूसरे वाले ग्रुप भी होते हैं. पता लगे तुम सारे देख रहे हो. हाँ ठीक है. देन इट इज ऑल राइट. कौन से वाले ग्रुप पे तुम्हें ऐड करो भाई? हाँ. दूसरे वाले ग्रुप में नहीं ऐड करूंगा. चैट वाले ग्रुप में आ जाओ बस. ऑफ्थल वाले. हाँ ठीक है. ऑफ्था वाले तक ठीक है. गुड नाइट. शबा खैर. बाय बाय. थैंक यू वेरी मच.